Welcome everyone to our weekly Q&A session with Toronto's Associate Medical Officer of Health, Dr. Vinita Dubey. Thank you so much for joining us again today.
My pleasure. Thanks for having me.
Absolutely. My name is Dilshad Burman. I'm a writer and reporter with CityNews and CityNews 680, and I will be moderating this chat today. The way it goes is we have been collecting your questions over the past week for the doctor. She's never seen them before. She's going to answer them off the cuff for us today. And if you haven't had a chance to submit your questions so far, you can still do so in the live chat in this broadcast, and we'll try to take as many questions as we can in this short 30-minute period that we have with the doctor. The other way this works is we also start off with all of our vaccine questions because to this day, they are top of mind for most people. And then once we run out of those, we will move on to the other questions. Having said that, if you have a non-vaccine related question, you can still submit it live and we will still take it. But for now, we're going to start off with these vaccine questions. Doctor, are you ready to go?
Let's go.
Wonderful. Let's start with Wings, who is one of our regular contributors to this AMA every week. Wings asks, are there any long-term case studies about the COVID-19 vaccines besides the known side effects like blood clotting and heart inflammation? I'm finding that my seasonal allergies are more pronounced after taking the AstraZeneca vaccines.
Okay, I mean, the manufacturers are continuing to follow people who have received the vaccine to see if there are any long-term effects. I actually think a lot of people are suffering from allergies this year. I think we're out and about more than we were, say, last year. It's really hard to know with something like seasonal allergies what is making it worse. For example, we know that there are more respiratory viruses that are spreading. For example, almost 30% of the respiratory viruses in Ontario are either enterovirus or rhinovirus. So, you know, we didn't see that last year at all. But to the question, yes, I mean, there are long-term studies that are occurring with the manufacturers.
Right, but currently there's nothing directly connected to sort of an increase in allergy symptoms or things like that.
No, there isn't. Yeah, and not with AstraZeneca in particular either.
Okay. Let's move on to CC's question. CC says, can you explain to me why people that are fully vaccinated are still ending up in the hospital? That's part one of the question. So first that.
Most of the people who are fully vaccinated and ending up in hospital are older. There often are seniors, some are from long-term care homes, for example, and we know that either they got the vaccine a while ago or they have a weakened immune system where they didn't actually get the best immune response to the vaccine. It's one of the reasons why we can't just rely on, you know, well, if you're vaccinated, you're fully protected, you could stop all precautions, because if you are at higher risk, even if you're vaccinated, it's less likely, but certainly more common in those who are older. That is who is really ending up in hospital fully vaccinated.
Right. And doctor, that's because of sort of the other underlying conditions, because of age, that kind of thing?
That's right. There are other chronic health conditions. They may have a weaker immune system. Exactly. Yeah.
Okay. And then the second part of Cece's question, will frontline workers need to take a booster shot since many of us were vaccinated in February? I will be working as an LTC worker, currently this month.
Yes, so there are going to be updated recommendations coming out from the National Advisory Committee on Immunization at the end of this week. So, and then it will be up to provinces to decide who gets the booster shot and when. So there will be updated guidance coming out.
This week, you said, right, doctor?
Yeah, yeah.
Okay. And then let's take a question from Twitter. James asks, and we get this a lot, so let's tackle this. If the vaccine protects you from getting sick, why do we need to protect vaccinated people from unvaccinated people?
Well, unvaccinated people still have a higher risk of getting COVID, and that the numbers are still bearing that out. We know that if you're vaccinated, you can still get COVID. We know that you're still more likely to get a less severe case. You're very less likely to end up in ICU, even less likely to end up in hospital. And so the vaccinated people are not always just protecting themselves against unvaccinated. They're also protecting themselves in general. So, the one situation where this person may be thinking of is, we say in a small indoor gathering, if everyone is vaccinated and you feel comfortable, you can take your masks off. Again, you always have to be able to judge your level of risk in the setting. And by having someone who's unvaccinated, that just increases the risk. That's just the numbers, really.
Right, right. And then this is an interesting one. I haven't heard this yet, but Debbie says, why are the percentages of stillbirths in Ontario up so high among vaccinated women? And
so actually, there's a website. It's called Born. That's the name of the registry that has the data for pregnancies. They're following this. I was actually on that website last week, and it did not show any increases in those who are vaccinated for stillbirths. I think what you have to recognize is stillbirths can occur. I mean, it's not as common, but they certainly can occur. And so really what you're looking at, it's not because you're vaccinated, you're going to be protected against the stillbirth, but you're not more likely to have a stillbirth. And so it's about doing those comparisons between vaccinated and unvaccinated. And there is no increased risk if you're vaccinated compared to unvaccinated.
And then let's move on to JD's question. JD says, is there any risk in mixing the regular flu shot with COVID vaccines?
The National Advisory Committee on Immunization has said that you can go ahead and get both of those vaccines together. In America, the American Committee on Immunization Practices had made that recommendation in the summer, actually. We know that both vaccines work differently. They're both needed to protect you against two different viruses. And so if you haven't gotten your COVID vaccine yet, please do get both. You could get them at the same time.
Okay. And then I remember last time we talked about it, it's still 2 shots though. It's not a mix.
That's right. It's still, one in each arm kind of thing, not, one super needle or anything.
Right. Okay. Good to know. Okay, let's move on to Peter's question. Peter asks, does a person's mental health impact their hesitancy to get the COVID vaccine, like an irrational phobia perhaps? And if so, how can they be helped?
There are actually a lot of reasons why people have hesitancy, and it's not just people who have phobias or a mental health condition that can make them have vaccine hesitancy. In fact, one of the biggest reasons for hesitancy is actually reading misinformation on social media, which has nothing to do with having a chronic health condition, for example. But I do definitely recommend that if you have like a mental health condition or a phobia that's preventing you from getting vaccinated, seek help, because there certainly is help available to get the vaccine in a way that you may be able to modify or accept, or it will be easier given your underlying condition.
Right. Like we've talked about this so many times, one of the biggest things is needle phobia, and there are so many different ways in which you can sort of try and overcome that. I know that even at the clinics, they do have accommodations for people. You can lie down, for example. We've talked about this before. You can put a numbing cream, all of those kind of things. But that's if it's needle phobia. I'm sure there are other hesitancies and other, mental health conditions that might preclude you from getting it. So there's definitely ways to do it, though.
Yeah, the other point just to add is that now compared to in the spring, many family doctors have access to the vaccine, for example. Most pharmacies have access to the vaccine. So there are actually other places to get that vaccine that may be less intimidating, maybe easier for you personally as well. And we know, for example, that the Hospital for Sick Kids has had some of these very specialized clinics to help some children who have some of these same concerns.
Right, absolutely. And I think that that's a big one, because even just the process of leading up to that mass vaccination clinic, all of that kind of adds to your anxiety. I know I've been there myself, and as you're getting to each step, you sign the forms, you do all of this stuff, and you feel a little more anxious each time. So I think if it's a setting like your doctor's office or even just your local pharmacy that you're comfortable with, that also reduces the anxiety for sure. Okay, let's move on to Ms. Sio's question. Ms. Sio asks, when will Canada approve the Novavax vaccine?
So it's not ready yet for approval. I think it's still in Health Canada's hands. A lot of it depends on what has been submitted. Has Health Canada asked the manufacturer for some more information? So maybe in November, it's really hard to predict when approval can occur. I think it's also important to know, though, that even if it's approved, it doesn't always mean that it will be available. So that's the other piece to consider is, would Novavax be able to ship their vaccine here once approved? And we've seen, for example, with Johnson & Johnson, we haven't actually really been able to get access to this vaccine yet, even though it has been approved for a long time.
Right, exactly. Okay, and then Henry has a question about testing. When it comes to testing vaccinated and unvaccinated people, when it comes to testing, why are we not publishing how many vaccinated and unvaccinated people were tested? What is the positivity ratio for each group?
It's a good question. I think the main reason why we don't publish it that way is because we actually don't collect the data that way. When you get a test done, there isn't, they don't collect that to be able to report that in the system to show. But so that's of all tests that were completed. However, those who test positive, when public health does the investigation, they determine vaccination status then, and that's how we know among those who are positive who has COVID and who does, or so who was vaccinated and who wasn't.
Okay. And then we already talked about mixing the vaccines. Yes. So let's move on to this question from Reddit. Can international students get an enhanced vaccine certificate? Online, it asks for the numbers on your green health card, which I don't have. I use my passport when getting the vaccine.
Yes, so there are certainly ways to get your vaccines. If you got your vaccines in Ontario, then usually you got a special number that you could put in place if you don't have an OHIP card number. So there are ways to access it. You could try calling the provincial number to see if they can access it. If the case is that you got the vaccine abroad and need to have it recognized here, then you can connect with your local public health unit. I know at Toronto Public Health, we have a survey online where you complete the information so that the public health can actually put it into the system.
But doctor, when it comes to getting that QR code, if somebody doesn't have a health number, because the QR code depends on putting your health number in, how do they do that? Is that still through the local public health unit?
Yes, so we've had that situation actually from the beginning of the pandemic, and often you'll get a separate number that you can use specifically for accessing the provincial site.
Okay. And then let's move on to AJ's question. Again, something that we get often. What's the point of the vaccine when viral load is the same in those who are vaxxed and unvaxxed?
Yeah, I mean, some papers show that it's the same. Some people, like, it's really hard to tell exactly what the viral load situation is like when you're vaccinated compared to unvaccinated. I think when you have symptoms, your viral load can certainly be higher. We know when you're vaccinated, your symptoms are less. But I think overall, if you look overall, those who are vaccinated are still much less likely to get COVID. And if they're less likely to get COVID, they're less likely to spread it as well.
Right. Okay. And then this is from Anonymous. Are religious vaccine exemptions being granted in Ontario or only medical exemptions?
So when it comes to the vaccine certification program, it is medical exemptions that are only being allowed.
Okay. And so as yet, we haven't talked about religious exemptions, because I remember this question coming up prior as well.
That's right. For the vaccine passports or vaccine certification program, there are no religious exemptions available.
Okay, wonderful. And then, well, not wonderful, but moving on. Next question. Jack says, the FDA just approved the Pfizer vaccine for 5 to 11-year-olds. What are your thoughts on the safety of this vaccine in kids?
Okay, well, I think, I mean, the FDA has obviously reviewed the data and felt that it was safe in kids. I've had a look at the data. I mean, certainly there were no concerning findings in what was reported in terms of for kids. What we do know is that it's a smaller dose. So the Pfizer vaccine for 12 plus, it's a dose of 30 micrograms, and in children, it's 10. So when you have a lower dose, it often means that you're less likely to get side effects. But then you ask, well, how do we know that that dose will work? And we know that when you're younger, you actually have your immune system works differently, can sometimes often develop quite a significant immune response to even a lower dose of vaccine. And so I think we also, though, have all the evidence from giving the vaccine to 12-year-olds and up, and know that the vaccine is safe in them as well. So we will wait for Health Canada approval. We'll wait for the National Advisory Committee on Immunization to give their recommendations as well too. But the fact that the FDA has approved it, I think, is, yes, a very good sign that shows that, first of all, the vaccine works and that it is safe for that age group.
Okay. And then that's sort of all of our vaccine questions for today. Let's move on to some non-vaccine related questions. B. DeRose asks, just wanted your thoughts on why no other therapeutics or alternatives are being looked at when it comes to COVID-19, when we now have 18 plus months of data to look at that show that there are other therapeutics that can be used apart from the vaccine.
Oh, yes. I mean, there are other therapeutics that are available now. I mean, there are different kinds of monoclonal antibodies. Like, there are different kinds, very different types of treatment options that are available. There currently isn't right now anything that's licensed in Canada that can be given, you know, at your first signs of symptoms or as soon as you test positive. Like, if you have a milder case of COVID, it really is mostly for those who end up sick in hospital or are more sick, for example. So I think the other point to know about just relying on treatments is those who get long COVID, sometimes they just have mild symptoms, and then but they still can get long COVID from that as well too. And so I think that's another important thing to consider about treatment versus prevention.
Right, and I think, I mean, as the saying goes, prevention is better than cure. So if you can just not get it altogether, that will be great. Okay, let's move on to Justin's question. Justin, Vin, and Eugenio actually have similar questions regarding PCR tests. So I will first take Justin's question. Please explain the meaning of cycle threshold for PCR tests and at what level they've been set in Toronto since the pandemic started.
Okay, so the cycle threshold it's a very kind of lab-based type test, a molecular test that really shows how many times do you have to cycle before you get a positive. Said very, that's probably not a very exact definition, but the higher the cycle threshold, the less likely your infection is from a recent infection, more likely to be from a previous infection. I see my video has frozen, but yeah. So on average, like each lab has to determine their cycle threshold. It's usually around 30 though.
Okay, and then I guess, so let's take Eugenio's question then. How do you decide on the PCR cycle? Has it always been the same or does it change?
It's up to the lab to decide that, actually. So they tell you what the parameters are. That's not uncommon. I mean, with a lot of lab tests, like even your basic hemoglobin or white count, it's the lab that gives you what is the reference range for that particular test.
Okay. And then Steve asks, why over the last 2 years have hospitals been labeling deaths as COVID deaths when they died from underlying conditions?
So there's two ways that COVID can be coded. It's either you die of COVID or you die with COVID, and both of those can be related. I mean, if you die with COVID and were admitted with a heart attack and die with COVID, the COVID may be the thing that contributed to your death. So there's no question that having COVID when you die can certainly contribute as the reason for the death.
Okay. And then, okay, let's move on to some reopening questions. Nuto asks, is returning to the gym still considered high risk despite having a vaccination requirement for entry?
Okay, so I think when it comes to gyms, you might want to determine whether your gym is going to continue to follow the vaccination certification with regards to capacity. And I think certainly with the vaccination certification, it lowers the risk, but being in an indoor setting, close to people, aerosolizing, all that hot air from working out is still a higher risk activity, absolutely. So we do still need to be able to be cautious. I mean, I think as things reopen further, we're going to continue to keep a very close eye on our numbers to see, what kind of spread is occurring.
Right. And then let's talk about ivermectin. Again, we get a lot of questions about ivermectin. Joe and Mary have similar questions. So Joe asks, ivermectin is one of the safest drugs on the market and has been used in humans for over 30 years. Why are we not studying this as a possible early treatment for COVID-19?
So ivermectin has had many looks for COVID. It certainly has. To say that it's a safe drug, I mean, it has a particular utility. With all drugs, they taken in the wrong way can be harmful. And there have been reports, like in Alberta, when they were in the height of their wave 4, that there were a lot of poison control calls from use of this drug. Like, it's not a totally benign drug by any means. And so I think we'll have to continue to wait. There are studies that have been done. They have not shown effectiveness. If there is one that shows that it's effective, then, there's no hesitation in using something that works.
Yeah, absolutely. And then Mary's question is slightly different regarding ivermectin, but she says, in the US, they are giving patients antibiotics, steroids, and ivermectin, plus telling them to take supplements. Are we not doing that here? And if so, why not?
So I can't comment on what's happening in the US, but I can certainly say the Ontario Science Table puts out recommendations for how to treat COVID. They continue to update it, and they continue to say that ivermectin is not recommended. There are other better and proven medications for COVID in Ontario.
Right. And then, doctor, we get this question a lot regarding, what kind of treatment are COVID patients getting in hospital? Are there specific drugs, or is it just, rest and recuperate? Is it just an IV? What are they looking at in hospital?
Yeah, there are specific drugs that you can give. The type of medications that you get when you're sick in hospital depends on how sick you are. Mm-hmm. What kind of COVID do you have? And that will determine what kind of medications you are treated with.
Okay. And then let's go to Bill's question. Bill asks, what is the protocol used when a patient presents themselves with COVID-2 emergency? Right now, people are sent home and told to take Tylenol and come back when the diseases worsen.
I think it depends on how sick the individual is when they're seen in emergency. Certainly, I know in my emergency department, people have been admitted because they were too sick to go home. There are often recommendations, though, that if you're not sick when you present to emerge, to go home to make sure that you're followed, like either whether it's a virtual visit or a connection with someone in your family, to make sure that if you don't get better, that you go back to the hospital.
Right. And then, doctor, when it comes to treating symptoms at home, if they're not severe enough for you to be admitted, what is the procedure there?
So you're really trying to treat your symptoms to help your body to get better. And so, for example, treating a fever is really important, because then you feel well enough, you're going to drink plenty of fluids so you don't get dehydrated, right? So getting enough fluids is also really important as well, too. If you're having trouble breathing, sometimes they can give you medications to help with that as well. So if you're sent home, often it's to use over-the-counter medications to treat your symptoms. But if you don't ever hesitate. Like, if your symptoms are getting worse, you're just not sure, you can see if you can connect with your doctor by phone or go to the emergency department.
Yeah, absolutely. Okay, let's move on to Brian's question coming in. If someone working at an outdoor bar or restaurant tests positive, what is the criteria used to determine which people that were at the restaurant when they were working need to self-isolate?
Okay, so hopefully if someone working at the restaurant tests positive, as a patron of that restaurant, you didn't have close contact for a long period to need to self-isolate. So often what you'll find is that it's the other employees who work there who would have had close contact with the person who might need to self-isolate if they are unvaccinated. But if they are vaccinated, then obviously they can continue to work as long as they don't have symptoms. So part of when someone tests positive, our communicable disease investigators do an investigation. They ask the person about, when they worked, what time they worked, how much contact did they have with people to determine who needs to be notified.
Okay. Okay, and then let's move on to the next question here. Are registered massage therapists mandated? Do they have to take the COVID-19 vaccine since they're in close contact with their patients?
I'm not aware that they have been added to a list. I would certainly say that a registered massage therapist often has a private practice, and they can have their own vaccination policies for this. But I would have to look that one up in terms of, but I would certainly absolutely say that I would recommend that actually all healthcare providers be vaccinated, especially when they're providing such close contact care.
Right. And doctor, when it comes to places that provide a registered massage therapy, is it mandated that the patrons are vaccinated, like at restaurants and things like that?
I believe it's because it's a healthcare setting. It's not considered a personal service setting like getting a haircut or some of those other things. Right. I think it's also important to note that in those settings, because it is considered a healthcare setting, PPE would be required. So again, wearing that mask, actually a face shield or eye protection when you are in that close contact with others.
Okay. And then let's move on to, we have 5 minutes, so let's do Kathy's question. Kathy asks, are those who have had COVID-19 immune from 3 months to COVID as well as the variants?
It's really hard to say absolutely. I mean, we know that if you've had COVID, you have natural immunity. In Ontario, we're saying, 90 days is typically how long the immunity lasts. Can it last longer than that? Absolutely it can. Does it last longer than that for everyone? No, absolutely it doesn't. How can we predict? It's really hard to know. It's also not guaranteed if there is a new variant, whether you will have protection. Now, right now, we seem to be stable on the variant front. I mean, after the Alpha variant in our third wave, at the end of the spring, we are now really 99% Delta variant. And it's hard to know how long that is going to last.
Right. And then the follow-up to that is during self-isolation, if a person becomes infected on day 14, but is asymptomatic, so they don't know that they're positive, are they infectious then the next day?
Yes. So if you are asymptomatic and get tested, you're considered contagious from the day that you tested, 2 days before to 10 days after. So if we don't have any symptoms, we use the test day. Now, sometimes it's about really making sure, like, are you sure, like in the last 1 to 2 weeks, you haven't even had a runny nose or something? Because sometimes people forget as well.
Yeah, absolutely. Okay, and then let's do anonymous. This is a question from anonymous. Are people getting the Delta variant wearing masks? Is there any data on masked versus unmasked infections?
Yeah, very good question. I mean, I actually think you could look at our overall numbers and looking also at schools. Like, I think if you look at elementary schools where students who are 11 or under have no vaccine, right? And they are wearing masks as well as doing a lot of other things in those school settings. And there are few instances certainly where COVID is spreading, where an outbreak is declared, but it's not all the time. Not every time COVID comes into the school does it spread. So I think that we're certainly seeing the effects of masks, physical distancing, screening like that. All of that is quite helpful with the Delta variant as well. We know that with the mask, like not all masks are alike, and a lot of it depends on the fit, right? How well it's fitted, how well you're wearing it, how many layers do you have, for example, and those things also contribute to being more protective as well.
Right. Okay, let's move on to Mario's question. Mario asks, if one gets COVID-19 and then is cured, would she become immune? I guess we've just answered this question, but good to reiterate, how long do you stay immune to it?
Yeah, I think it's important to look even at some of the data that's coming out from the US where people have had COVID and they're getting COVID again, like they're getting reinfected. And so that's why we really do recommend that you get vaccinated, because it's really hard to be able to give you that confidence to say that you are protected. Because I'm sure if you got COVID once, you do not want to get it again.
Yeah, absolutely, absolutely. Okay, and let's move on to Eugenio's question. Oh, this is a second question from Eugenio. How can you distinguish between the variants?
So it's actually based on lab testing, where they actually do what's called whole genome sequencing. So for the positive samples, a certain select of them are going for whole genome sequencing, and that's how they can determine what variant it is.
Okay, and then we have 1 minute left. I'm going to squeeze this in. What do you think of these monoclonal antibodies for COVID positive patients? Where will we get this infusion, if at all?
So there is a defined criteria for what patients are recommended to get it. And so there's certainly, when they're given in the hospital setting for the patients that meet the criteria for it.
Right, so you can't just decide that you want it and get it as a preventative or something like that.
That's right, yeah.
Okay, and so that just about brings us to time. I won't squeeze in another one. We're already at 1:29. So thank you so much, Doctor, for your patience in answering all of these questions. Thank you to everybody that participated this week. And if you still have any questions that we didn't get to, please continue to submit them via social media. We will have the doctor back with us again next week. For now, we'll say bye-bye and see you next week. Thanks, Doctor.
Bye.
Bye-bye. Okay, we're clear. Thank you, Doctor.
Okay, thanks. Okay, bye-bye.
Bye.